Welcome, friends. It's time to elevate and thrive. And on today's show, we have a special guest, Dr. Annie Armstrong from Head to Toe Spine and Sport Therapy, our favorite manual therapy clinic in the world.
Absolutely.
I love the world.
Yeah, in the world.
No,
I would agree with that.
absolutely in the world.
Yes.
Cutting edge, the absolute smartest, best, highest level practitioner provider. And you're going to bless us with some knowledge today.
Absolutely. Yeah.
So glad you're here.
Yeah, we've got, I think, a really fun topic today.
Which is,
Really, it's about soft tissue injury.
yeah,
You know,
why we get
and
hurt.
Why
Yeah.
we get hurt, what the underlying cause is. I think that the biggest thing when patients come in with a new injury, they really mostly don't know why they got it. And they don't understand how they got hurt, or they didn't really do anything different, or their workout was normal. They didn't lift heavier. They were just gardening again, and or, right? And all of a sudden they've got quite a bit of pain, and they're not sure why. So that's what we want to get into.
I love it. And I would say this would distinguish between somebody who actually has fallen, or they have, they were working out in the middle and something, they felt something pop or change, right? So just distinguishing between the two, this is a chronic
Yeah, I mean, I think.
picture.
Yeah, I think.
Well,
I think
they can be connected together, right?
exactly right. I think that looking at the different ways that soft tissues are injured, really, that's definitely the most obvious, right? We roll and pop our ankle out, and all of a sudden there's swelling and heat, and we can't walk, and we know we've been injured. So that's a given, and most of us know what to do with that. But the other forms of soft tissue injury are a little bit more unknown.
Yeah, because one of the things that's interesting, right? So let's use the example of you're working out, right? You're working out, and this almost happened to me last week. I was doing some heavy back squats, and on my second set, I felt a twinge in my right hamstring, and I just now, being that I've been lifting for a long time, that I knew I could not keep going. But had I been, my 10-year younger self, I would have kept going, and then I would have not been able to walk the next day, right? So common misconception would be that, I had maybe gone too heavy, or my form, for that split second, and I injured myself. But what you're saying is that actually that's a buildup that then put me in a position of being compromised.
Yeah,
most likely.
Sometimes. Maybe your back squat form was not up to par. That's always a possibility, but I doubt it. Come on.
My form is pretty.
We're talking great form,
Yeah,
right? Totally.
Been squatting.
So, I think maybe it's important to define too, what soft tissues are, right? So we all just think muscles, but there's muscles, tendons, nerves, blood vessels, right? I think in this topic we're going to talk mainly about muscles, and I think it's important to understand really what makes up a muscle. We just don't think of it. We have millions of. Every muscle has these millions and millions of little tiny spindles, right? And each muscle spindle's got its own blood supply and its own nervous system.
That's a muscle fiber. Was that common parlance? A spindle and a
we could
fiber?
talk
Are they
muscle
the same?
fiber.
Are they the same? Are they the same?
Not
or
exactly,
not really?
but we don't need to get
Okay.
into that, in definitive terms.
we
But I
won't.
just want you to think about the compilation of a muscle, right? And I also want you to think about really, we don't like a healthy muscle, what it feels like to touch. If you touch your own arm, does it feel like when you're relaxed and not using it, it should be soft and flaccid. It shouldn't be hard, right? A muscle that's hard at rest is a muscle that's got too much scar tissue in it, right? Which is one of the things I want to sort of describe is what is scar tissue and how do we get it? And then we work up to why your hamstring kind of popped on you.
So a scar tissue, when we are talking about a muscle, that's not like scar tissue. Is that similar to, or does it look like? Because what immediately comes to my mind is, I got cut when I was a kid and I have a scar on my leg, right? That's
Right.
scar tissue.
You're thinking like a wound healing look, right?
Yeah, like a wound thing.
Yeah, so what we're talking about with, in your definition, we're talking about an overuse injury, right? Which is the most common in athletics, or people who are working at a desk frequently and they're typing like mad for 10 hours a day without resting their forearms, right? So we're talking about this overuse pathology. So the background really is, when we back to the muscle anatomy, right? And these muscles are being usually, say, for example, let's use an example of a cyclist, right? Who's riding in sort of a bent forward position. And then for example, they also work at Microsoft. So then on their off time, they're sitting, right? And so those two positions are similar to the anatomy of the hip flexor, right? So the hip flexor sitting in a shortened position, it's being heavily overused with cycling. There's no intervention by the athlete at this time. And that muscle is getting tighter, it's getting shorter, and it's also micro tearing because it's getting used so heavily without an intervention. So that muscle's micro tearing, and the little tears don't heal in that same soft, supple fashion that a muscle needs to be. A muscle has got longitudinal fibers, they're oriented the same direction. When they're relaxed, they're soft, supple, so they can contract and relax and do what they're supposed to do for us. So when they heal up more like a tangled up ball of yarn. That's how I like to describe it. Mm-hmm. So they're tangled up. They're not oriented the same way. There's an interruption to the blood flow to the muscle. There's an interruption to the nervous system of the muscle. And the muscle's just not going to function like it should. So we can take a little bit of that. And if we use some interventions, which we'll talk about at the end, how we can sort of prevent this overuse injury from happening, then we can slow that down. But that muscle, that's what's happening. And especially if you don't diversify your movement that much and you don't reset with soft tissue work, right? So this is going on, it's going on, and that scar tissue is kind of tangling on other muscle spindles, other muscle fibers, and it's building up. So eventually you're like, oh, I've got this knot in my upper back. I've got this knot in my, like, this feels like hard, right? So just to tell the end of the story, so that muscle keeps building up, it keeps shortening. Lack of blood flow, lack of nutrients, lack of oxygen, it's degrading. And muscle goes from tendon to bone, right? And so it hauls on that tendon as it shortens. The tendon starts to respond to the stress of the muscle always pulling on it. And then what does it do? It eventually starts to thicken. And then we as humans start to feel some twinges of pain.
Mm-hmm.
Pain's long. It's a long way down.
That's a long process. And,
it's a long road.
And also kind of coming back to, that's also what you're describing as like an area of scarring as well, when we're getting those knots or the trigger points or lack of blood flow to that particular area, the shortening of that area of muscle.
Yes. Adhesions is probably a better word, but scarring is easily understood. It's really just that muscle's not healing in that same form because it can't, right?
Yeah, because it's because the action is not being corrected. The same form is occurring every single day.
Right. Yeah, and we're doing the same action to the muscle every single day. And that's why we see in people with a single sport, high school athletes, where they're crushing it all year long with the same sport, they tend to really show up with these overuse injuries. Doing repetitive patterns without a soft tissue intervention is going to end up.
Well, and that's where I feel like something like a CrossFit, historically, where it would get people in trouble is that they'd like train at high intensity. Well, one, sometimes people will come in and train at high intensity who were deconditioned, and so they'd go too fast, right, too hard, too soon, and that could cause an injury. But here more on this overuse side, I just think of my own history with CrossFit. I had done it for like 7-8 years. And I think in the 7, 8, or 9 years I was heavily CrossFitting, I don't think I had one massage. I don't think I saw one. I had to go to head to toe one time. You know what I mean? And it was like, because I was just like, you're in crush mode or whatever for 9 years. And then all of a sudden, one day, you can't lift your arm over your head because your shoulder is destroyed, right? And then every time you try to do a back squat, your hamstring freaks out. And now all of a sudden it's like, I'm broken. And it feels like it came on overnight. Well, no, it didn't really come on overnight. It came on over years of overuse without any kind of intervention, any kind of treatment to, preventative maintenance here.
Right.
That's kind of what we're talking about.
I mean, but also with, looking back at the days of CrossFit when the classes were smaller and the coaches were more involved, I did find a lot of the great coaches really catching that early pattern movement dysfunction, because muscles will, even if they're not hurting yet, if they've got that underlying adhesion and that buildup in there, you're going to see it in an athlete's movement.
Interesting. Meaning like they're going to restrict the way that they move or kind of protect the area.
Yes. Yeah. Okay. The body's going to start compensating because we're great compensators. So you'll start seeing a movement dysfunction, and a coach will spot it, and that brought a lot of people in. Like I butt wink, or I tilt to the side more when I'm squatting, or and they'll catch it with that. And that's a great, and that's why a movement screen of some type is such a great early preventative tool.
Yeah, movement screening. That's nobody even thinks about that anymore as much. That's
No,
a great
we
idea.
do.
I know.
Yeah.
Yes.
Head to
Yeah.
toe.
Yeah, so that's why you guys are
Yeah.
amazing, and that's why. Honestly, I want to mention that's why we send everybody to you, because you're so comprehensive. And what I always tell people as holistic chiropractic, although I feel like chiropractic, the term maybe doesn't catch everything really that you do. So I would just want to give that shout out.
Well,
Yeah.
we also send everyone here. It's like we should be in one building, but we're in two buildings.
Jeez.
But it's a great team. But I think also we would be, remiss not to also mention the other way, besides this sort of overuse injury, that soft tissues really get hurt. And this is really common, especially with COVID and the work from home on my kitchen table or my couch crowd. And I'm people are getting sort of a postural injury. And what's happening there, was imagine sort of that head forward posture. You're staring at your computer all day long. This is what you see so much of. Those muscles are very, very tight, right? And they become hypoxic, which is a fancy word to say they don't have as much blood and oxygen to them. Mm-hmm. And so the same process starts, but differently, right? Mm-hmm. And so the muscles are also then not getting enough nutrients and blood flow to them. And as a result, they also start to tear and microfracture. And that's what you see in that upper back and neck, which is the most common. Oh, they're just so stiff neck, and their traps are all rock hard. And, it really is starting to hurt. They're getting headaches. And that's where that is coming from, is that same. And really, the interventions are really similar to the two injuries, but they come from different places.
So and I wonder most people say as they're having pain, they're thinking, well, I'm not really doing anything. Like, why? And that's actually the issue, right?
Yes.
They're not doing anything. They're not addressing
anything.
the posture, not getting adjusted, not getting aligned, also not addressing like having your head forward all day, right? As you're sitting.
Yes. And not doing that soft tissue reset, right? And so remember, like when your muscles are being used, which is hopefully all the time, you have to break that overuse with a soft tissue reset. And hopefully we can share some just simple things people can do with lacrosse ball or a foam roller to really kind of address some of that early loss of blood flow to the tissue, some of that early scar tissue buildup to the tissue, so that you can really prevent that injury. I mean, it is amazing what a little bit of self-care can do. And I have to remind people that stretching's not it.
Yeah,
right?
which I find fascinating. I know a recent podcast you guys had about like talking about stretching is not the way to go, which was actually, it felt a little surprising to me. Like,
yeah, it's kind of sad because stretching always kind of feels good.
Right.
You're like, oh, I'm stretching, I'm doing it, but it's not preventative for this type of thing. So really using that soft tissue intervention is the much, much better way to go. Stretching just kind of tightens up those knots even more and or causes some more tearing. Like, it's not that helpful. And it also slows down performance. I mean, that's a whole other talk, but stretching is, it's well researched that it slows down performance in an athlete. So, another good thing to keep in mind.
There's a lot of myths to debunk around stretching.
There is so many myths.
That is fascinating to me. I know that's a whole other subject, but
yeah.
So
it is interesting.
If you're like, whoa, mind blowing, I need to replace my stretching with something else when we're talking about soft tissue mobilization. Let's talk about some of your favorite strategies then for helping a person start to get into some of these areas and create a little bit more blood flow and break up some of these adhesions.
Well, I think we mentioned it's like the lacrosse ball is the bomb.
It's the golden.
Lacrosse ball is the gold standard.
Yes.
I mean, it's a
tool.
$5 tool that when used correctly, and right, when I say correctly, people have a misconception that when they use a lacrosse ball or a foam roller, they're going to roll back and forth over a sore spot. So really what we're going to do is we're going to find that most acute part, and we're going to trigger the ball on it at the pressure that you can withstand. And you're going to leave it on there for a minute to 2 minutes.
And you're talking about like when people are listening to this, you're talking about like the knot, right? People are like,
the knot.
my knot. Right?
Yes.
Yes. Okay. The area of
and there's really specific ways you can, get into position to really target it. And we go into a lot of detail with this in the clinic because people, usually don't know how to do it correctly. But then you find the knot, and as long as, you want to avoid bone, and you want to, if it's causing numbness or anything like that or tingling, then you're on the wrong spot. But it's hard to hurt yourself with a lacrosse ball. That's the great thing. Like,
doesn't
it's
feel that way.
It hurts.
Does not feel that way.
Yeah. So, Yeah, so that's a great way to go, and then just really hitting that muscle, targeting it, and letting that trigger point and that knot sort of melt away underneath the ball.
Do you feel that? What about so? Where does the foam roller come in as well? I mean, is that a 1-2 combo, or if you could only have one, do you have the lacrosse ball, or should you really everybody have both of those things?
Well, I mean, I'd like to use both, but I mean, I think if you were to have one, it would be a lacrosse ball.
Really?
Yeah.
See, I feel like you've changed your
hard-
tune on that. Now, I
A
can
little
say
bit.
that just because I've known you so long. We've worked together so long. Because it used to be the foam roll was the gold standard. That's why I asked this question. This is just really
this
me
is
because
good.
I
This is
heard
good.
the
Pin
tune
Dr. Andy
has
down.
changed. This is the foam. I am looking at it right now. The foam roll queen. Like foam roll
I love
was
the foam
what
roll.
she was obsessed
I love
with.
the foam roll.
Obsessed.
Now,
And I
let
can't
me
believe
just
I heard this.
differentiate for you.
Lacrosse ball
so
is the new thing.
for your huge muscles, like your quads and your adductors, absolutely the foam roll's the way to go, right?
Yeah.
Because it's going to take you a year to lacrosse ball that much structure. Absolutely. So, foam roll is my preferred. And again, I tell people go to Amazon Basics and buy that black roller, right? It's like $20 or whatever. Don't buy like a vibrating roller, one with knobs or anything with sound or lights. Or it doesn't matter. Just the most basic tool you can find. So I do like the foam roller for those bigger structures, but for things like, shoulder, upper back, some parts of your lower neck, lower back, hips, I do prefer feet. Calves, prefer a lacrosse ball.
Yeah, it's just maybe more versatile. You can get into more places, get into the nooks and crannies.
Yeah,
so to speak.
Nooks and crannies.
Yeah.
So yeah, both. Get both. It'll cost you $25.
So you were saying you getting that lacrosse ball on the trigger point or the knot, and then 1 to 2 minutes of kind of focused movement, or kind of focusing the movement or pressure in that area.
Yes, and then move on to your next spot.
So then if you're going to get one more tool, because I always like things in threes, what would be the third one? Would it be something like a Theragun or one of those like a percussion gun type deal?
I don't think you need three, Barry.
I mean, I just like to buy stuff, so I always like good things come in threes. Or would it be like rock tape? That would be another interesting one.
Yeah, no.
I feel like that's hard to use. Or cream, like a topical cream, like a CBD cream or something.
A topical cream would be great.
I do. There are some good CBDs. I feel like
CBD, a good CBD cream.
Or would you maybe recommend?
magnesium.
Yeah. Okay. Right. Oh. Okay. So
Magnesium
magnesium.
creams,
I was going to
right.
say maybe
Yeah,
a little
magnesium.
crossover. Maybe the third thing is some IV nutrient therapy.
Thank you.
Yeah.
Thank
Exactly.
you, Barry.
Yeah, totally.
Yes.
Yeah.
Yes.
Remember
Way
which
to work that
podcasts
in.
are on
yes,
here?
that's right.
Yeah, or just maybe movement diversity. Let's put that as a third thing.
Yeah.
Okay.
Or maybe just move more.
Yeah.
Maybe that could be your third thing.
Not stretch, to be very clear.
You can stretch, but I think we can talk to our next expert a little bit about how to stretch for increased performance. There's different types of stretching, right? So the chronic sort of long hold stretching is definitely out.
Yeah, that's the stretching everybody knows and thinks
Yeah.
about, right? And I blame this all on high school athletics from
Absolutely.
the 70s, from the 60s, 70s, and 80s.
Hey,
because it
still-
was the standard,
Yeah.
and I'm sure it still is to this day.
They're still doing the
feel
full.
like I was going to say, you see most teams, or they kind of stretch. They come out and stretch, right? So
Yeah, it's a little behind.
yeah.
Lagging. Well, this was fascinating. I loved it. I learned some stuff here on just how thinking about muscles and ways to describe it and kind of get ahead of it, because I think one of the challenges, of course, in preventing injury is knowing, what you can do ahead of time to stop that major thing happening. Well, then takes you out of action for a long period of time. And I think you've given us some real insight into some of the clues to look for, some of the strategies we can use, both from a postural standpoint as well as then from a self-care standpoint. But then in the case that we need extra help, what should a person do?
I can think of something.
Oh, let
me.
Let me think here. Well, for one, they could check out our resources, and would be the lacrosse ball videos. They're available through our Facebook page, through our website. There's lots of ways to access
YouTube, tons of stuff on YouTube. We have a phenomenal resource library.
And that would be the head to toe. I mean, tell me the site.
It's headtotoeclinic.com.
.com.
Yeah, so we could access them there or on our Facebook page. We have
And Instagram.
tons of resources for self-care. I would say if you're experiencing pain, you have to get, let's get checked out and make sure, see where that tissue is, injury has gone to. Because remember, pain, as we've said, is the last signal you're going to get. So once you've progressed to pain, you're kind of a little bit I don't want to say in trouble, but you definitely need to be assessed.
You're past, yeah. So
Yeah.
the other recommendation I would say is to actually come and see you.
Well, thank you.
Yes, I would say, if you're in that space, make an appointment with Dr. Annie and her team because, I just find that sometimes instead of like self-diagnosing and doing just self-care, which is amazing, but having that coach or that guide is just invaluable.
Thank you.
Yeah, I would agree. And I generally say, hey, if it's going on for like more than 3 days, if you're getting into 4 or 5 days, if it's significantly impacting your routine, your ability to perform just your regular everyday life or the activity that you've been doing and now you can't do it, and it's been like 3-5 days, that's when I would say that's a great time to go in. And if it's chronic, like if it's come up before, that's also another, that's just hey, danger, Will Robinson, that's like you are in a situation where you should go get some extra help. Right?
Yes.
Okay. Awesome. Well, Dr. Annie, it has been a pleasure having you on the show. Thank you.
Wonderful.
We will have you on a future show as well.
Thank you.
It's always learn something and always have a great time when you're here. So thank you for sharing, and we will see you on the next one.